Good morning to you, to Raul, and to all our audience tune in every day with respect and discipline. Today is June 14th, a memorable day for all the peoples of our America and especially for us Cubans. They were born in two different centuries and in two different countries, but two men converged infinitely more than on their date of birth, but in their actions. This date, in 1845, in the city of Santiago de Cuba, Antonio de la Caridad Maceo y Grajales, the Bronze Titan and hero of the two great wars of Cuba for its independence from the Spanish yoke. And a date like today, 92 years ago, Ernesto Che Guevara de la Serna was born in Rosario, Argentina. He was the medical doctor and revolutionary who came with Fidel on board the Gran Mayat to fight for Cuba, the heroic guerrilla. These are two great men for our America and for Cuba. Che was a tenacious revolutionary in everything concerning Latin American independence and gave clear evidence of that when he opened the guerrilla front in Bolivia. Maceo led the protest of Baragua in 1878, embodying the decorum of the most dignified Cubans and their willingness to persevere in their independence purpose. In both Maceo and Che, revolutionary intransigence was a common denominator. And we remember today these two great men with a heartfelt homage. And there is nothing better for this than rightly performing our daily work and with the fulfillment of what is to be performed. And likewise, World Blood Donor Day is also celebrated. You know that we have been holding for several days activities devoted to blood donors, and through this briefing, we want to convey our sincere recognition to all blood donors and those who care for them. We know that what blood donation means for those who work in health and people in general. It ensures that lives can be saved many times. And in Cuba, blood donations are free. And we stress this because that is not the case in other parts of the world. And here in Cuba, that is achieved through the great work performed by the committees of the Defense of the Revolution and by our specialists in the primary health care and all the institutions of our country, because this is an activity that is carried out voluntarily by a group of people who are continuously donating blood. And so, in this day, a well-deserved tribute for all blood donors and to Las Tunas province, which today will be vested with the recognition of national best province on this field. And with this, we start our briefing today, and we start also with the good news that we have one more day without deaths, third consecutive day. 435 patients are admitted to the country's hospitals. 8 are under surveillance, 213 are suspected, and 214 are confirmed cases. And then our primary health care service, our professionals and specialists monitor 501 patients due to certain epidemiological risks. Yesterday, the island's different molecular biology laboratories processed 2,135 samples, and as a result of this study, 10 people were diagnosed with COVID-19, representing 0.46% of processed samples. Thus, Cuba has already studied 133,763 samples, by our laboratories. And as a result of this study, 2,248 people have tested positive for COVID-19, representing 1.7% of all the samples studied. The 10 cases confirmed yesterday, they are all Cuban. 6 are confirmed case contacts, and 1,969 people in the epidemic in Cuba are in this category, and they account for 89.2% of all the cases. Yesterday, in 3 of the cases, the source of infection has not yet been determined. I will continue the studies to trace the source of infection, and in the cumulative total in the Cuban pandemic, 78 of the diagnosed cases, their source of their infection has not been identified, and this represents 3% of the cases. So 78 people whose source of infection has not been determined. Of the 10 cases diagnosed yesterday, 1 had a source of infection overseas, abroad. He's a traveler who returned on the 5th of June, who was under observation since his arrival in an isolation center for travelers, and he was tested, and he tested positive to COVID-19. Of the 10 cases diagnosed yesterday, 5 are male, accumulating 1,137 cases. That's 50.5% of all confirmed cases are male, and 5 of the cases yesterday were female, totaling 1,111 patients of the female sex, 49.4%. 8 of the cases diagnosed yesterday were asymptomatic, and although in the tally diagnosed in Cuba they are 1,200 people, 53% have been asymptomatic at the moment of the diagnosis. However, in the study that we mentioned yesterday, which remains unchanged, 80% of the diagnosed cases in the last 15 days are asymptomatic. And I highlight this to call the attention on the need of continuing complying with the measures. 2 of the 10 cases belong to the 20 to 39 years age group, and 8, that is 80%, belong to the 40 to 59 years of age. No children were diagnosed yesterday with COVID-19. 9 of the 10 cases belong to Havana province from the municipalities of Arroyo Naranjo, San Miguel del Padrón, Habana del Este, La Lisa, and Marianao, and 1 of the cases is attributed to the province of Camagüey, but as we said, he was one of the travelers and contracted the disease abroad. With these results by provinces, Havana, although it reduces its incidence rate of confirmed cases per every 100,000 inhabitants to 8.76%, it's lower than yesterday. However, it still has the highest rate in the country. It is followed in second place by Matanzas with 1.25, with a similar rate like than yesterday. These are the only 2 provinces reporting positive cases of COVID-19 in the country in the last 15 days. And with this, we can affirm that Artemisa, Ciego de Ávila, Granma, Pinar del Río, Mayabeque, Villa Clara, Cienfuegos, Santi Espíritus, Camagüey, Las Tunas, Holguín, Santiago de Cuba, Guantánamo, and the Isle of Youth municipality have not reported any new case in the last 15 days. 13 provinces plus the special municipality have not reported COVID-19 cases. This is an achievement and a demonstration that if we abide by all the measures, we can succeed. And we have no doubt that with their efforts and work being carried out in Matanzas and Havana, that these provinces will make it with everybody's support. Of the 2,248 patients diagnosed with a disease in Cuba, 214 are admitted as active cases in our hospitals. And of them, 209 patients, that is 97.8%, have a stable clinical condition. We always regret the death of 84 people who have died as a result of this disease in our country, for a lethality of 3.73%. And with this lethality, Cuba stays in the 18th place among the countries of the region of the Americas reporting COVID-19 cases. We always mention the two evacuees, and yesterday we had another favorable and satisfactory element. 25 people were discharged yesterday, many more discharges, more than double than the number of confirmed cases. And thus, 1,948 patients diagnosed with COVID in our country, 86.7% have recovered and are currently being monitored at home or back to their normal lives. We are reporting today 5 cases in serious condition. They are receiving all treatment modalities available and the best care by our specialists. And while they are not reported in critical condition, they are in serious condition. 3 of them are admitted at the Salvador Allende Hospital, and 2 are at the Luis Diaz Soto Military Hospital, both in Havana. So this is the current behavior of the pandemic in Cuba. And the same 185 countries of the world continue reporting cases. After diagnosing 144,820 new cases yesterday, and notice this figure, the world already reports 7,625,883 confirmed cases. And 4,741 people died in the world due to COVID-19, totaling 425,931 deaths, for a lethality of 5.59% for the world. And I repeat this over and over again every morning, and I always come here with the hope that at some point this is going to change. But I do not believe that with these numbers, with this data, things will change soon. And this serves as a call for the need of continuing complying with the restrictions established if we want to continue succeeding. In the region of the Americas, the region already reports 3,718,697 confirmed cases, 79,303 cases yesterday, and this accounts for 48.76% of the total cases in the world. And yesterday, in our region, 3,050 people died for a lethality of 5.35%, lethality accumulating 199,119 deaths. And last, now that the country is almost eliminating the transmission, with the exception of the provinces of Havana and Matanzas, we know that they will control the spread. We wanted to mention the number of confirmed cases and deaths of the countries that top the list in the world. I am referring to the United States with 2,048,986 cases, 114,669 deaths. Brazil is next with 828,810 confirmed cases and 41,828 cases who have died. And Peru, also included in the list, with 220,749 confirmed cases and 6,308 deaths.